Welcome back to the Remote Work Network. I am Remote Pug, and I'm here to bring to you a bonus video for this week for another work from home job. So without further ado, we're going to go ahead and get into this particular role and position. It is with a company called Wellthi or Wellthi, however you would like to pronounce it. And they are looking for a remote care advisor. Okay. Wellthi is a digital care concierge for families with chronic, complex, and ongoing care needs by tackling the logistical aspects of caregiving. Wellthi helps employers increase productivity, improve retention, and reduce time away, all while giving employees the support they need to care for themselves and those that they love. Okay. So, as a virtual care advisor, you will assist with various tasks to support families and individuals and address their unique caretaking needs. We love collaborating here at Wellthi. They go on to say, you will be working closely with care coordinators and other care advisors. You will report directly to the care manager. To be successful in this role, they're looking for you to maintain a task load conducive to employment status of full-time to part-time, conduct research and assess large amounts of information effectively and creatively, remain solution-focused and engages in creative thinking to secure quality solutions in a timely way, collaborate with care coordinators and managers by using your expertise and know-how to support tasks to help Wellthi members, collaborate with care coordinators, care advisors, specialists, and managers to help Wellthi care recipients and families. Okay. By using your expertise and know how to support with tasks, support with improving and updating Wellthi's guides and knowledge resources, represent Wellthi at events such as health fairs, open enrollments, and external webinars. Travel and expenses are covered by Wellthi if interested when applicable. Okay. So they're stating to you that there may be some travel involved for this role, but overall your duty and workstation will be remotely. But they will compensate you for traveling. Okay. And that sounds fun to kind of, facilitate and put together health fairs and things of that nature, get to network and meet and greet new people. So I think that's a very cool fact. You will also work with other non-client specific work, which will include, but not limited to, feedback and guidance on Wellthi's products, services guides, contribution to team culture, writing, advising for marketing materials, and support and teamwork for other service team members. Be responsible for preparing and submitting claims to insurance companies. Understand the complexities of insurance policies, coding procedures, and other regulations. Use medical coding systems to translate medical procedures, diagnosis, and treatments into standardized codes for accurate billing. So with that being said, you all, that was a mouthful of buzzwords. If you have medical billing and coding experience, if you have medical terminology experience, if you have ICD-9, ICD-10 experience, definitely you will want to take a look into this role. And any type of background in any type of clinical field, I would say on both engaging with patients or working in the health and administrative side. But more importantly, medical coding and a thorough, I would say, understanding of insurance policies and procedures, understanding how insurance is billed, and how certain medical procedures needs to be coded for insurance purposes. So I'm just throwing that little hint of information out there to assist you with that. When I interviewed at this company, it was for a care coordinator, which is what my professional background is of now, but in a different realm. That I'm just sharing that just so you are not getting it confused with care coordinators, but you will be working closely with care coordinators, and care coordinator managers, okay? Consistent communication and follow up with insurance companies, facilities, and providers to resolve billing related issues. So once again, that's a buzzword, medical billing. Contact providers to request submissions of prior authorizations. I'm sharing with you now prior authorizations. That would be a buzzword, and that would be a transferable skill. Provide information, insurance policies, benefits, coverage, and eligibility. So have thorough knowledge and understanding of how medical insurance works. Verify insurance coverage for specific services and procedures. Investigate claim denials and request submissions of corrected claims for medical providers, or appeal the claim and determination if necessary. For this particular role, if you have any experience in appealing grievances of claims reviewer, claims processor as well, I highly, highly, highly encourage you to look into this particular role and position as well. Okay? Follow up with insurance companies on pending and overdue claims to ensure timely processing and payment. Collaborate with providers to obtain necessary documentation for claim submission, resolve billing related issues, track payments for multiple insurance claims. The role. In the care advisor financial role, you report to the care manager and work directly with wealthy care coordinators as well as fellow care advisors to assist with various tasks to support families, individuals, and address their unique caretaking needs. Tasks you may work on can depend on your area of expertise, but may include researching, vetting legal services, financial and government assistance programs, providing your expertise when it comes to insurance coverage and plan types such as Medicare and Medicaid and Medi-Cal and Medi-Cal. That is based out of California. I'm just sharing that with you now. In the past, I worked for a company where I had to have skills in Medi-Cal, and that was based out of California for a facility there. So I'm just giving you that heads up now on that. Long-term care insurance, as well as billing claims and health insurance appeals. You will drive some of the following efforts. You will collaborate with care coordinators and care advisors, specialists, and managers to help wealthy care recipients. Let's move on because I have kind of touched base on that several times. Qualifications required for this role. It is important to note that you will need the ability to work in a fast-paced environment, be flexible, creative, and be comfortable in knowing that we are constantly evolving. At the top of the list, this is a remote work experience. They are requiring to have associate's degree or higher, 5+ years work experience in medical billing and or coding. Your experience may include 1 year in customer service and administrative experience, 2 years of experience and familiarity of commercial, private, or government insurance plans, such as Medicare and Medicaid. Certification in medical coding, long-term care insurance, or patient advocacy, knowledge in health insurance appeals, knowledge of legal terms and understanding of legal documents, ability to work independently while being communicative and collaborative with coordination team. Once again, remote work experience preferred. Proficiency in more than one language is a plus. Proficiency with Mac COS systems, G Suite, Slack, and 1Password preferred but not required. And strong ethical standards and respect for client confidentiality, ability to integrate and collaborate well with others while adapting to evolving service experiences, knowledge and ability to navigate the healthcare sector. I just want to go ahead and touch bases on the word Slack up there. That is a messaging system or app that is used to communicate amongst your coworkers. So if you're not familiar with that, just know that that's kind of more of their version of, Microsoft Teams or Hangouts, those types of messaging systems or apps. So that's what Slack is going to be used for. The salary starting at 22 at the lowest and ending salary $24 an hour. Total rewards package. This is what they're offering. Remote work environment. Medical, dental, vision benefits, retirement savings account with matching company contributions. Mental health benefits, 15 days paid vacation, 2 additional days for each subsequent years, up to a maximum of 25 days. Professional development initiatives for growth. Generous parental leave, maternal and paternal, during a new child's first year, born into a family or adopted. This is a fully remote position. Fully remote position. Our Wealthians are located throughout the United States, but we are currently not accepting candidates in the following states. So let's pay attention to that. Alaska, Hawaii, Maine, Mississippi, New Hampshire, New Mexico, North Dakota, Oklahoma, Rhode Island, and West Virginia. If you reside in any of those states, they will not be accepting your application. So for anyone else that stays in other areas in the United States territory, I highly encourage you to apply for this role. What are some of the additional role requirements? You must work from home. You must have a strong internet connection and quiet space to take calls. Professional, distraction-free environment. What to expect in the hiring process? Before hiring a care advisor, we put individuals through a rigorous screening process, which includes interviews, case studies, reference checks, and background checks. And I would like to emphasize on the screening process, you will receive a series of case studies, which are assembly test runs and scenarios of what would you do and what you would do in that instance. Okay. So I'm just sharing that with you now. I had to go through that as part of the interview process as well. So I'm just wanting to share that so that you are prepared in advance. Okay. Training. If a care advisor is invited to join the team, they then go through a 2-week boot camp training program with a daily curriculum of learning, shadowing, and hands-on work that is both self-guided and collaborative with other advisors and coordinators over Zoom videos. At the end of the 2 weeks, a care advisor must pass our certification test before being allowed to work with families. The certification tests for proficiency are in the following: technical knowledge, use of Wealthy platform, customer service, the Wealthy way of communicating and delivering a high-touch customer experience. Then what is next? We encourage you to apply for this position by clicking below. Okay. We understand that there is no perfect candidate and never expect every candidate to meet 100% of the qualifications listed above. Okay. We look for Wealthians to enhance and advance our company from their past experience. Our diverse backgrounds and perspectives are what make Wealthy a top company to work for. Okay. The rest of this information is pretty much their EEOC and disclaimers. If you are interested in applying for this particular role, you can apply with your LinkedIn, which is listed here below. Going through these series of questions and information. And at the very top, once again, they're hiring for a remote care advisor and is with the company Wealthy or Wealthy. however you want to pronounce it. If you're interested in this particular role, I encourage you to go ahead and apply for this position. Link will be posted in the description box below this video. Thank you so much for tuning in to the Remote Work Network. I am your remote plug, where I bring to you work-life balance opportunities. And I will see you later on this week. Thank you for watching.